The Knowledgeable Provider podcast is educational, entertaining, and not the same as medical training. The information presented here should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, go see your own knowledgeable medical provider. Opinions expressed on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. It's all fun and games until someone gets sued, am I right? Okay, on with the show. Hey, welcome back to Knowledgeable Provider. I'm your host, Jody Marks. I've been paying a lot of attention to the news and political podcasts lately. Honestly, it's been hard for me to pay attention to much of anything else. And today I would like to summarize, review, go over the changes that have been made so far by the Trump administration that somehow affect healthcare. Obviously, I'm not a political pundit or an economist or an expert on really anything or a policy wonk. There are plenty of super smart people out there who talk about all that stuff constantly for a living, and I highly recommend some of their podcasts. They're really brilliant people out there. What I am, of course, is a humble, lowly practitioner of family medicine who is liable to be impacted by all of this, along with, everybody else. I also just try to be an informed, engaged citizen/voter. Maybe I'll throw an opinion section, a commentary section in at the end, but I'll warn you before that's coming. As much as I'd like to say I've been tracking and keeping up with all this point by point, that is not the case. It's been such a flood of information that it's been pretty hard to keep up with. So what I'm looking at is an article from the American Journal of Managed Care, published on March 28th, 2025, written by Juliana Grassi, with additional reporting by Pearl Steinzer, Julia Bonavita-Cola, Hayden Klein, Kyle Munns, Christina Matina, Brooke McCormick, and Mary Caffrey, and then an article from the Kaiser Family Foundation, originally published on January 28th, updated most recently on March 28th, 2025. This one's written by Jennifer Cates, Josh Michaud, Kelly Moss, and Lindsay Dawson. This one is specifically focused on the global impact of the things that are happening in our country, so I'll try to weave these two together. But that's where the information's coming from. Of course, I'll put links to these in the show notes, and we'll just go in chronological order. So here we go. As soon as Trump took office the second time, he rescinded a bunch of executive orders and actions that had been issued by the previous president, Joe Biden, including Executive Order number 13987, which has the concise and catchy title of Organizing and Mobilizing the United States Government to Provide a Unified and Effective Response to Combat COVID-19 and to Provide United States Leadership on Global Health and Security. Most of that order really was not relevant anymore since it was done in the middle of the pandemic to address what was going on in that moment. One thing that may be significant in that is the elimination of the Directorate of Global Health, Security, and Biodefense, along with the senior director of that, who is part of the National Security Council. That person and that organization were responsible for coordination of all the different agencies working in that space, so we don't really know who's going to take over that kind of coordination role at this point. Another initial executive order was to rescind enrollment expansions as part of the Affordable Care Act, which of course threatens some people's ability to obtain insurance coverage and associated financial benefits. And obviously that's going to affect the most vulnerable people in society, folks with the least resources. He put a stop to some newer drug pricing models, which were aimed at reducing costs for generic medications and new therapies, or innovative therapies is how it's worded. That piece of the puzzle probably will not have much impact on out-of-pocket costs for most of us. There were some Biden-era policies here that were left intact, including Medicare's $35 cap on insulin, the $2,000 annual out-of-pocket cap for Part D drugs, and the ability of Medicare to negotiate drug prices. Another immediate action was to withdraw the United States from the World Health Organization, or WHO. Of course, we already did this once back in 2020 during Trump 1.0, allegedly due to the WHO's, quote, mishandling of the COVID-19 pandemic and other global health crises, failure to adopt urgently needed reforms, and inability to demonstrate independence from the inappropriate political influence of WHO member states, unquote. There's also a thought that we, the United States, are contributing more than our share of money to the World Health Organization compared to other countries. When Biden took office in 2021, we were back in the WHO, so now we are back out of it again. Evidently, this whole process of withdrawing from the WHO actually takes a full year to finalize, so we weren't really totally out of it at the time we got back in it. So now we're starting the same process of withdrawing again. So we will actually be fully out of the WHO in January of next year, 2026. The order specifies who is going to establish new mechanisms within the United States government to replace some of the functions that the World Health Organization has been doing. Of course, we're going to stop giving them money or any sort of other support. We are reassigning our government personnel or contractors working with the WHO in any capacity, and we're going to try to look around and find some, quote, credible and transparent U.S. and international partners to assume necessary activities previously undertaken by the WHO, unquote. The order specifies that someone is going to review, rescind, and replace the 2024 U.S. Global Health Security Strategy. The Secretary of State is going to stop negotiations on the WHO Pandemic Agreement and amendments to international health regulations. And the order specifically states that, quote, actions taken to effectuate such agreement and amendments will have no binding force on the United States, unquote. So obviously the loss of us and our money is going to have a pretty big impact on the World Health Organization. Apparently we provide about 16 to 18% of their revenue, as well as people, technical experts, advisors, whatever. I thought I'd look a little bit more into what the WHO actually is and what it does. So it's a specialized agency. It's part of the United Nations. It was established in 1948 to be responsible for international public health. It's headquartered in Geneva, Switzerland. It's active in over 150 countries. Core functions include leadership on global health matters, including setting priorities and goals related to public health, coordinating global responses to pandemics and outbreaks, developing standards, guidelines, policies on an international level, promoting research in healthcare and the dissemination of the information that comes out of that, monitoring trends, as in tracking disease outbreaks, monitoring the performance of different health systems, looking out for risk factors. In that vein, it publishes a report called World Health Statistics and another called Global Health Observatory Data. It provides technical support to countries to help strengthen their healthcare systems, which includes training, funding, guidance for national health strategy. It has a specific program called the Health Emergencies Program. That's a program with 2 M's and an E on the end of it that actually deploys emergency teams and different resources to areas where they're needed. And they generally promote good health and disease prevention. So things like tobacco cessation, nutrition, mental health, maternal and child health, non-communicable diseases, vaccine access, etc. Another immediate action was to pause funding and review all U.S. foreign assistance to assess alignment with American values. So this impacts really all global health programs, or almost all of them. Waivers have been granted for foreign military financing for Israel and Egypt, as well as emergency food assistance and the salaries of the employees of the United States government who are involved in that, as well as contractors. That happened on January 24th. Those waivers were announced. 4 days later, January 28th, Secretary Rubio issued another waiver that covers, quote, life-saving humanitarian assistance programs, unquote. But that does specify that this waiver does not cover things that, quote, involve abortions, family planning, conferences, administrative costs, gender or DEI ideology programs, transgender surgeries, or other non-life-saving assistance, unquote. February 1st, another waiver for PEPFAR, which is the U.S. government's initiative to address the global impact of HIV, which was a Bush-era policy, by the way. February 4th, another waiver that protected programs related to TB, malaria, malnutrition affecting maternal and child mortality, and some other life-threatening diseases and health conditions. February 7th, the U.S. District Court in the District of Columbia issued a temporary restraining order that prevented people from losing their jobs, but did not stop the funding freeze. Several other lawsuits pertaining to this were filed over the next few days. February 13th, the court issued another temporary restraining order to block the stoppage of funding for anything that was already in existence as of January 19th. The government contested that ruling. There's a bunch of back and forth happening. The court ends up upholding its ruling for the restraining order on February 20th. There's some more back and forth. March 5th, it makes it to the Supreme Court, and they deny the request to get rid of that restraining order. March 10th, Secretary Rubio announces that they're cutting 83% of programs at USAID. Same day, the court issues a preliminary injunction to try to stop that. There's some more back and forth. Eventually, the Fourth Circuit Court of Appeals stays the preliminary injunction so that DOJ can go back to work dissolving the USAID. And as far as I can tell, the current state of things is that they intend to move some functions of USAID into the State Department and then get rid of the rest of its functions by July 1st of 2025. And it seems like most of the USAID staff now have been fired. More about USAID. That stands for U.S. Agency for International Development, which is the primary government agency responsible for administering foreign aid and development assistance, created in 1961 by President Kennedy, operates in over 100 countries with the mission to promote global development and humanitarian efforts that advance U.S. foreign policy, improve lives abroad, and support global stability and prosperity. Core functions include global health in the form of programs that fight infectious diseases like HIV/AIDS, malaria, and TB, improving maternal and child health, expanding access to clean water, nutrition, and reproductive health services, humanitarian assistance in the case of natural disasters, wars, famines, providing emergency food, shelter, medical aid, and disaster recovery support, supporting democracy and human rights in the form of supporting free and fair elections, anti-corruption efforts, the rule of law in general, promoting human rights through programs that protect vulnerable groups, including women and minorities, encouraging economic growth and trade through job creation, entrepreneurship, and market development, supporting small businesses, agriculture, infrastructure products, improving access to education, especially for girls and marginalized populations, building teacher training programs and literacy initiatives, supporting conservation, clean energy, climate resilience, and sustainable agriculture, helping countries to adapt to and mitigate the effects of climate change, and helping countries transition from states of conflict to states of peace through building strong, stable institutions in those regions that are still fragile or recovering from the effects of some conflict. So the thing about that with USAID is that it was created by an executive order in 1961 as part of the State Department, but in 1998, Congress established it as an independent agency within the executive branch. So the executive branch really does not have the authority to dissolve it without Congress. So there's that. On the domestic front, that federal grant freeze threatens funding for Medicaid. The White House is saying that this will not affect Medicare or Social Security, but Medicaid is not explicitly protected. So that creates some uncertainty about federal funds that match state funds for Medicaid. Of course, the Republican Party writ large is trying to pass a budget that would for real cut Medicaid funding by a lot, $880 billion over the next decade. So obviously that would affect a lot of vulnerable people's healthcare, those vulnerable people being low-income populations and children. Regarding HIV, they're looking at getting rid of the HIV prevention division of the CDC. They removed some pages about HIV prevention from the CDC website. That was eventually restored through a court order. I just looked this up. I looked up CDC HIV prevention. There's a box at the very top of the page that says, quote, per court order, HHS, which is Department of Health and Human Services, is required to restore this website as of whatever time on February 14th. This, again, this is literally what it says. I'm quoting. Any information on this page promoting gender ideology is extremely inaccurate and disconnected from the immutable biological reality that there are two sexes, male and female. The Trump administration rejects gender ideology and condemns the harms it causes to children by promoting their chemical and surgical mutilation, and to women by depriving them of their dignity, safety, well-being, and opportunities. This page does not reflect biological reality, and therefore the administration and this department rejects it. And then the information about HIV prevention is still there. They have canceled funding for the nationwide diabetes prevention program, which is part of the NIH, National Institutes of Health. This program has been gathering data and tracking patients with diabetes for the last 30 years. The reason for this cut in funding is not clear, although apparently the bulk of that program's funding has gone through Columbia University, which the Trump administration seems to hate. So there's some speculation that maybe that's the reason. On March 20th, they extended the opioid emergency for another 90 days. And apparently, efforts to combat that are working. Over the past year, deaths due to overdoses have declined. I'll go back to this issue about gender identity. This was one of the initial January 20th orders. That is a very wide-reaching blanket sort of order. It says, quote, "It is the policy of the United States to recognize two sexes, male and female," unquote. And it directs the executive branch to, quote, "enforce all sex protective laws to promote this reality," unquote. The order defines sex as, quote, "an individual's immutable biological classification as either male or female," unquote. It says that sex is not a synonym for and does not include the concept of gender identity, and that gender identity does not provide a meaningful basis for identification and cannot be recognized as a replacement for sex. It directed all federal agencies and employees to enforce laws relating to sex-based rights, including, quote, "accommodations to protect men and women as biologically distinct sexes," unquote. It directed agencies to remove all statements, policies, regulations, forms, communications, or other internal and external messages, quote, "that promote or otherwise inculcate gender ideology," unquote. It directs agencies to do everything they can to end the federal funding of gender ideology and rescinds several executive orders from the Biden administration, including 13988, which was called Preventing and Combating Discrimination on the Basis of Gender Identity or Sexual Orientation, and 14075, which is called Advancing Equality for Lesbian, Gay, Bisexual, Transgender, Queer, and Intersex Individuals. On January 24th, they reinstated what's called the Mexico City policy, which prevents foreign NGOs from having anything to do with abortion. That was first put in place in 1984 by the Reagan administration. Apparently it comes and goes. Every time a Republican's in office, they reinstate it, and every time a Democrat's in office, they get rid of it. So I guess now it's back in effect, and they're looking at some other programs that fall under what's called the Kemp-Kasten Amendment, which specifies that the United States does not give any funds to, quote, "any organization or program which, as determined by the President of the United States, supports or participates in the management of a program of coercive abortion or involuntary sterilization." On January 24th, we rejoined the Geneva Consensus Declaration. This was established in 2020, created by the United States and 31 other countries, with the objectives of, quote, "securing meaningful health and development gains for women, protecting life at all stages, defending the family as the fundamental unit of society, and working together across the UN system to realize these values." So essentially, this is a rejection of the idea that there's an international right to abortion. The Biden administration took us out of that in 2021, and now we're back in. February 4th, we have an order to review the United States' participation in all international intergovernmental organizations, conventions, and treaties, and to withdraw from and end funding to certain United Nations organizations, allegedly because some of the UN agencies and bodies have drifted from their original mission of promoting international peace and security and are acting contrary to the interests of the United States while attacking our allies and propagating anti-Semitism. Specifically, that would be the UN Human Rights Council, the UN Educational, Scientific, and Cultural Organization, and the UN Relief and Works Agency for Palestine refugees in the Near East. Of course, the United States is a big source of funding for these programs, $2.4 billion in contributions last year, 2024, which makes up about 19% of all of the United States' global health funding. So there's going to be a 180-day review of all this, which will end on August 3rd, 2025, and we'll see what happens after that. February 6th, we have an order to stop funding non-governmental organizations or NGOs that undermine the national interest and administration priorities. So we're reviewing all funding that the government provides to all NGOs that have to do with global health or foreign assistance. Evidently, most of the money the United States provides for global health assistance is actually channeled through different NGOs. In fiscal year 2022, 62% of our global health funding was provided to different NGOs. February 7th, we have an order to stop supporting South Africa, specifically, evidently due to the South African government's treatment of Afrikaners. That probably sounds super ignorant if I pronounced it wrong. Afrikaners, who are also known as Boers. These are descendants of Dutch settlers of South Africa that showed up in the 1600s. So, in other words, these are white folks in South Africa, and evidently the dominant majority group of white South Africans. So, those would be the people who were in charge of everything until apartheid ended in 1994. Evidently, the Trump administration regards their treatment as race-based discrimination. Back to some more specific examples affecting domestic policy, there was some guidance from CMS that was initially released a couple years ago about health equity for Medicaid and the Children's Health Insurance Program, or CHIP. So this guidance affects people's ability to apply for social services related to health matters. These would include interventions for housing or home environment that are medically necessary, such as air filtration, mold removal, accessibility modifications like wheelchair ramps, short-term housing, short-term rental assistance, and nutrition interventions. And I guess that is still gone. I don't see that information from CMS, just Googling it. The administration is working on challenging the portion of the Affordable Care Act that requires private insurers to cover preventative services without cost sharing, and says that insurance companies should be able to invoke religious beliefs to allow them to not have to cover things like PrEP for HIV prevention. They're questioning whether or not the USPSTF has the authority to say what services should be covered without the Senate being involved in that. The specific case is called Braidwood Management versus Becerra, which is going in front of the Supreme Court. So obviously that would affect a lot of services that are now covered at no cost to the patient. They have tried to get rid of FDA guidance on diversity in clinical trials. I feel like that's kind of bubbled to the surface lately, where when I hear people discussing clinical trials now, they will say like, well, all the patients in the study were white. Maybe we can't generalize this to other populations. There was some guidance on that from the FDA. They removed that under the order to get rid of DEI programs. It was gone for about a week, and then a court order forced them to restore it. February 19th, there's an executive order to expand IVF access by reducing costs. I'm not sure really how that's going to happen, or whether or not LGBTQ people are going to be eligible for that somehow. They are trying to terminate the Health and Human Services Advisory Committee on Long COVID, which was established in 2023, but apparently had not even done anything yet. They're also trying to get rid of the CMS Health Equity Advisory Committee, or I guess they did get rid of it. I saved the best for last here. That would be Mr. Robert F. Kennedy Jr., our new Secretary of Health and Human Services. During his confirmation hearing, he kind of backpedaled on statements he's made about vaccines in the past, saying that he supports the use of vaccines, even though he's clearly been an opponent of vaccines in the past, based on his public statements. He failed to acknowledge all the evidence that has been produced to show that there's no link between vaccines and autism. He was asked about his role in perpetuating vaccine hesitancy during a measles outbreak in American Samoa back in 2019, which ended up leading to 83 people dying from measles. He reversed himself on abortion. When he was campaigning for president himself, he advocated for reproductive rights, and now he's saying that his view aligns with the Trump administration's position that should be left up to the states. He defended his claims that Black people and white people ought to follow different vaccine schedules. Evidently, he kind of struggled with understanding the differences in Medicaid, Medicare, and Medicare Advantage regarding how they're funded and structured. So after that, he did end up getting confirmed. Evidently, there was some concern about him having a conflict of interest because he runs some kind of anti-vaccine nonprofit agency, which he said he would resign from. He did make commitments to healthier food policies and a, quote, pro-American agenda, unquote, whatever that means. February 20th, the new secretary ordered the CDC to postpone its first meeting of the Advisory Committee on Immunization Practices, where they were going to vote on several vaccines. He stopped campaigns for the flu vaccine, and it seems like he's working on getting rid of several of the key advisors who work on vaccine approvals and public health decisions about different things. Notably, Dr. Peter Marks recently resigned. That story actually was the thing that really caught my attention and made me want to try to get a handle on all this. He was the FDA's top vaccine official. He played a big role in the whole Operation Warp Speed to produce COVID vaccines under the first Trump administration. This is not a Biden guy, right? And I mean, if my uncle says that there's something fishy going on, then I believe him. I'm just kidding. He's not my uncle, no relation. But he resigned over the secretary allowing, quote, misinformation and lies, unquote, to guide his thinking behind the safety of vaccinations. His initial intent apparently was to try to work with Secretary Kennedy, but he came to the conclusion that that was not going to be possible, so he left. Most recently, on March 27th, Secretary Kennedy announced a plan to restructure, I guess, all of the federal public health agencies. He wants to cut 10,000 jobs and consolidate different functions within the FDA, the CDC, and some of the other agencies that fall under HHS. That's going to be 3,500 jobs at the FDA, 2,400 at the CDC, and 1,200 at the National Institutes of Health, NIH. About 10,000 people have already voluntarily left those agencies, so it's going to end up reducing the total HHS workforce by 20,000 people. And then some other healthcare-related appointees who have been confirmed. Dr. Jay Bhattacharya, apologies if I mispronounced that, is an MD, PhD, who is now the director of the NIH. He was pretty critical of the handling of the COVID pandemic, specifically lockdowns and mask mandates. He felt like alternative viewpoints were suppressed during the pandemic and that damaged public trust. So it sounds like this dude definitely wrote some prescriptions for ivermectin. But he said during his confirmation hearing that he supports providing good data about vaccine safety. He disagreed with Secretary Kennedy's ideas about the connection between vaccines and autism. He wants to support early career scientists, address chronic diseases, and restore public trust in the NIH. And then we have Dr. Marty Makary, who is an MD and confirmed as the commissioner of the FDA. He is a surgeon from Hopkins and also a Fox News contributor. That's about all the information I see about him. And then, of course, we have Dr. Oz, the TV guy, who is nominated to be the administrator of CMS. He talked about the fact that healthcare costs in the United States are so high, but we still have worse outcomes than other comparable nations. He talked about streamlining our healthcare system through greater use of technology. He doesn't seem to be opposed to the idea of cutting Medicaid, or at least he wants to make it more sustainable by eliminating fraud and improper payments. And he was just confirmed by the Senate a couple of days ago on April 3rd. In the interest of fairness, I did look up the Whitehouse.gov information about what the administration is doing. One order that was not mentioned in the previous articles was one from February 13th, an executive order to establish the Make America Healthy Again Commission, which will be chaired by Secretary Kennedy, tasked with, quote, investigating and addressing the root causes of America's escalating health crisis with an initial focus on childhood chronic diseases, unquote. They're supposed to come up with information on that within 100 days, and 180 days they're supposed to come up with a strategy on how to improve the health of America's children. 4 main policy directives, quote, empower Americans through transparency and open source data and avoid conflicts of interest in all federally funded health research. Prioritize gold standard research on why Americans are getting sick in all health-related research funded by the federal government. Okay. Work with farmers to ensure that U.S. food is healthy, abundant, and affordable, and ensure expanded treatment options and health coverage flexibility for beneficial lifestyle changes and disease preventions. The commission aims to, still quoting here, restore trust in medical and scientific institutions and hold public hearings, meetings, roundtables, and similar events to receive expert input from leaders in public health, unquote, and cite some of the efforts made by the first Trump administration, including the right to try, which gives terminally ill patients access to life-saving cures, an executive order to fight kidney disease with more transplants and better treatment, accelerated genetic treatments for sickle cell disease, declared the opioid crisis a public health emergency in the first place, and expanding access to telehealth in rural and underserved communities. Just some more detail on that. The right to try law was actually passed by Congress, and Trump signed it into law in 2018. Essentially, this waives the need for FDA approval to try experimental drugs for terminally ill patients. The executive order about kidney health works to encourage the development of home dialysis machines, so essentially provides more funding for that through Medicare, and also promotes kidney transplants. I'm going to say this, I'm about to surprise myself here. This should have been part of Neff Madness if it wasn't. I guess that would have been in 2021. And it was. Hey, look at that. It actually was a region in Neff Madness 2021. How about that? Good job, Neff Madness. The Thing about sickle cell disease is also a law passed by Congress. The full name is the Sickle Cell Disease and Other Heritable Blood Disorders Research, Surveillance, Prevention, and Treatment Act of 2018. In 2020, Health and Human Services launched a program called Sickle Cell Disease Training and Mentoring Program, also known as STAMP, to train primary care providers on the basics of sickle cell evaluation and management. The NIH initiated a program called Cure Sickle Cell Initiative to try to speed up gene therapies looking to cure sickle cell. There's not a whole lot of information after that, so I don't know how much of an impact that has had. The thing about telehealth was an executive order from August of 2020 that allowed telehealth services to be reimbursed at the same rate as an in-person visit, which as far as I can tell is still in effect. So does that mean I could still be doing telehealth visits in my pajamas instead of seeing people in person? I'll have to look into that. One more change that I found on the Whitehouse.gov website talks about making healthcare prices transparent. February 25th, he signed an executive order to, quote, empower patients with clear, accurate, and actionable healthcare pricing information, unquote, which aims to make sure that hospitals and insurers disclose actual prices and not estimates, and to make prices comparable across different hospitals and insurers, including for prescription drugs. Okay, I think that's it. I think there's about all there is to say about these changes that have happened recently. I said I was going to wait and see how I feel at the end of this to decide whether or not I'm going to opine about all this stuff, but I will give an opinion. So here it comes. Here's my personal opinion. If you want to turn this off now, proceed at your own risk. I will admit that I learned something about the executive orders and laws passed during the first Trump administration that actually sound like good ideas. I don't know if that's because there were more adults in the room back then, or maybe after all this is over, we actually will look back at all this stuff and say, hey, maybe this was a good idea. Maybe they knew what they were doing all along. I hope so. I'm all for increasing efficiency and improving healthcare. I like the executive order about making pricing more transparent for patients. That's a huge problem. Other than that, I don't really see how a lot of this is going to result in anything good. I think if you want to fix the healthcare system, you have to go after insurance companies. As far as I can tell, that's really who controls the healthcare system and who is responsible for most of the problems. These for profit companies whose goal is that to make a profit. And what I see is this administration allowing them a religious exemption not to have to cover preventative services for people. What I see after really going through all of this and looking at it in detail is that it's all just based on the same old Republican shit about discriminating against people they don't like. You know, it's anti-LGBT stuff, getting rid of things that help people who are not white and male and rich. And to be fair, that's a lot of what they ran on. So maybe all conservative policy is just based on discrimination. It's kind of hard not to see it that way. I do not like the attack on DEI. I think the whole point of DEI is to make sure that people are hired and promoted based on merit rather than race, which is exactly why they say they're getting rid of it. And in my opinion, all of these people that Trump has appointed to lead these agencies are a bunch of unqualified white men for the most part. So I think that speaks for itself. That's exactly why we need DEI. I do not like the attack on gender affirming healthcare, or seemingly even the existence of transgender people or non-binary people. As far as I'm concerned, that's just mean. That's just transphobia. That's just hate coming out. Look, I'm not an expert in transgender care or hormones or any of that stuff, but MAGA World acts like there's all these children who are being allowed to have gender reassignment surgery and take hormones at the drop of a hat, but that's just not how it works. I would say pretty much nobody in their right mind is in favor of letting a child decide that they want to have surgery to become the opposite gender. For the most part, I think what they do in those situations is put children on puberty blockers, which allow them to have more time to go through the process of figuring out their gender situation and then making a decision later on when they're an adult about which way they want to go. Puberty blockers are fully reversible. Once you take the person off of those, they go through puberty. And I think that in all cases, those decisions should be left to patients and their families and their healthcare providers. I thought the Republican Party was all about individual freedom and keeping the government out of your personal life. So why do the same rules not apply to people who are not like you? I'm super duper tired of the stupid bathroom thing. Does anyone really care who is urinating or defecating in the stall next to you in a bathroom? They act like men are going to pretend to be women so they can legally go in the women's bathroom and, I don't know, attack people. Okay, if someone is horrible enough to do that, do you honestly think the signs on the outside of the bathroom with the little man and the little woman are preventing them from doing that currently? That is not a thing. It is not a problem. It's an imaginary issue that they have created to whip people up and scare them into voting for Republicans. I don't like the attacks on abortion. Of course, I have nothing to do with providing abortion care at all. And sure, the idea of abortion in general kind of makes me squirm, but I'm very much in favor of the right of women to determine what happens to their own bodies. One thing that jumped out at me reading through all of this is how much you have to read between the lines of these policies to really understand what's going on with them or what the true intent is. I'll never forget one of the very first elections I voted in. I do not remember specifically what the amendment was about or what the law. I don't remember what we were voting on. At that point in my life, I just went bebopping up into the polling place without really doing a lot of research and was surprised by all the stuff that was on the ballot other than, the presidential election. And there was some amendment, I assume it was to the Alabama Constitution. The way it was written, it said something to the effect of, are you in favor of letting rapists and murderers out of jail and inflicting them on the population? I did not know to look out for that kind of thing. I was like, well, of course not. And that's a great example of how you just have to, first of all, be informed. And second of all, really pay attention to what things are about and how they're written. So the thing about saying that gender identity is not the same thing as sex, why would they go out of their way to say that? Well, I think that's an attempt to get around these federal laws that prohibit discrimination on the basis of sex, meaning that, it's fine to discriminate against somebody who's trans or non-binary or whatever. Also, the thing about the UN and anti-Semitism, if you just read that on its face, you're like, well, obviously we can't be for anti-Semitism. But I think that means they are doing something to help the people of Gaza. Protests about that are primarily why the Trump administration is mad at Columbia University, which ties in with that other thing about funding the programs that go through Columbia University. The Make America Healthy Again thing, is it good? Is it bad? It's hard to tell. The goals that are laid out in it sound pretty good, but remember who's in charge of it. It's nutjob Robert Kennedy. And if you read the goals with that in mind, you start to think, they're talking about all this stuff that he's been yelling about. All that's real open to interpretation and very subjective. So is it good? Is it real? Or is it bullshit? I don't know. Guess we'll find out, right? I'm going to stop talking now. Thank you for listening. Special thanks, as always, to our Patreon supporters. I'll be looking forward to the results of the next rounds of Neff Madness. I think I've probably about peaked in how well I'm going to do. I think there's not much hope for the last two rounds, so I'll just hope that I don't completely crash and burn. I hope you have a great week, and I will talk to you later. All right, that does it for this episode of Knowledgeable Provider. Very special thank you to our Patreon supporters. If you would like to help support the show for just $5 a month, please head over to patreon.com/knowledgeableprovider. If you're looking for more content, check out our YouTube channel and our Facebook page. Remember, all of those ratings, reviews, likes, follows, subscriptions, etc. really do help the show, so take a second and do those things to help me out. If you have a request for an episode topic or if you'd like to be a guest on the show, I'd love to hear from you. Email me anytime at thekppod@gmail.com. That's thekppod@gmail.com. Thanks so much for listening, and as always, stay safe, take care of yourself, and take care of your patients, in that order. The full name is the Sickle Cell Disease and Other Heritable Blood Disorders Research, Surveillance, Prevention, and Treatment Act of 2018. It looks like it promotes efforts regarding research, surveillance, prevention, treatment. Oh, well, that makes sense why they called it that.